Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with hormones and metabolism ailments starting with the letters C and D. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material on this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, and hair. Then conditions of the eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, and bladder. Then ailments specific to women and specific to men, then issues of the hormones and the metabolism, and then homeopathic remedies for infections, infestations, and the immune system. Then issues surrounding fertility, pregnancy, childbirth, postnatal problems, and then homeopathic remedies for infants, ailments and diseases in child, and special issues of adolescents, and finally special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Natrum people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, ganglion, of stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitudes towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with hormone and metabolism ailments, starting with the letters C and D. Metabolism is the sum total of all the chemical processes that occur in the living body, and it is ultimately controlled by instructions contained in the chromosomes in the nucleus of every cell. But cells must coordinate their activity, and to do this, they must communicate. The nervous system provides communication via nerves delivering messages in microseconds, and the endocrine system provides communication via hormones, which travel around the body in the bloodstream. Chemically speaking, hormones are either proteins, amino acid derivatives, or cholesterol derivatives, and they are secreted in response to nervous stimuli, such as sight, touch, hearing, taste, smell, thoughts, emotions, and also in response to various chemicals in the bloodstream, including other hormones. The pituitary gland at the base of the brain, for example, secretes a number of hormones designed to stimulate other hormone-producing glands into action. The hormones produced by these subservient glands circulate in the blood, but if their concentration in the blood falls below or rises above a certain level, the pituitary adjusts its output of trophic or stimulating hormones. However, the pituitary is not the prime mover of the endocrine system. This role is played by the hypothalamus. The hypothalamus is a distinct group of cells at the base of the forebrain with extensive connections to the cortex, brainstem, and hindbrain. Stimulating and inhibitory hormones secreted by the hypothalamus in response to nervous impulses from other parts of the brain travel the short distance to the pituitary beneath it, and the pituitary responds by increasing or decreasing its secretory activities. The anterior lobe of the pituitary secretes growth hormone called prolactin in order to stimulate production of breast milk and hormones that stimulate the thyroid and adrenal glands and also the ovaries and testes. The posterior lobe of the pituitary produces antidiuretic hormone in order to decrease the secretion of water by the kidneys and oxytocin to stimulate the milk flow and contraction of the womb after childbirth. The thyroid gland, which lies in the neck opposite the Adam's apple, produces thyroxine, which controls your metabolic rate, which is the place of the chemical activity in every cell in your body. Iodine is an essential component of thyroxine. Directly behind the thyroid are the 4 parathyroid glands. These produce parathormone, which together with calcitonin produced by the thyroid control calcium metabolism. The 2 adrenal glands, one perched on top of each kidney, secrete the fight or flight hormone adrenaline and noradrenaline in response to stimulation of the sympathetic nervous system. The adrenal glands also secrete steroids, all of which are made from cholesterol. 2 of the most important steroids are aldosterone and cortisone. Aldosterone controls the balance of potassium, sodium in the blood, and cortisone plays a crucial role in carbohydrate, protein, and fat metabolism, and many other processes. The adrenal glands also produce small amounts of androgens, which are masculinizing hormones in both women and men. However, the major androgen production role in the male body occurs in the testes, which produces testosterone. In women, femaleness, fertility, and the menstrual cycle are controlled by estrogens and progestins manufactured in the ovaries. The testes also produce small amounts of estrogens. Another very important endocrine gland is the pancreas, which lies under and behind the stomach. It produces 2 hormones that regulate the level of glucose in the blood, insulin and glucagon. Insulin encourages cells to absorb glucose, and glucagon encourages stores of glucose to be released into the bloodstream. Both hormones are produced in response to levels of glucose in the blood. If the cells that produce insulin become diseased or unresponsive, the result is diabetes. Many other parts of the body, such as the heart, kidneys, stomach, intestines, and placenta, also contain cells that produce hormones. Cushing's Syndrome. Cushing's syndrome is most common in young or middle-aged women and brought on by long-term steroid treatment or by overproduction of steroids by the adrenal glands, perhaps because of an adrenal or pituitary tumor. The typical effects include a moon-faced look, weight gain, development of a pad of fat between the shoulders, the wasting of muscles leading to weakness and fatigue, purplish streaks on the skin that resemble stretch marks, easy bruising, depression, and low sex drive, and in some cases osteoporosis, diabetes mellitus, high blood pressure, or heart failure. Women who suffer from Cushing's syndrome usually stop menstruating and develop a deep voice and extra body hair. Men become impotent and less hairy. Constitutional homeopathic treatment is recommended in addition to orthodox treatment, which may consist of surgery if a tumor is present, or prescribing drugs or other steroids for conditions such as asthma and rheumatoid arthritis. Diabetes. Diabetes may be brought on by damage to the pituitary gland or, more commonly, by the malfunction of the pancreas. Diabetes insipidus is caused by a deficiency of antidiuretic hormone, ADH. This hormone is produced in the pituitary gland and stimulates the kidney to reabsorb water from urine. But if the pituitary is damaged, such as by a head injury, surgery, radiotherapy, or a tumor, production of ADH may slow down or stop. The kidneys will then allow huge amounts of water, up to 35 pints a day, to be lost in urine, and the person will be obliged to drink equally large amounts of water to replace this loss. Other symptoms are dry hands and constipation. Orthodox treatment consists of synthetic ADH in the form of nasal drops and surgery if there is a pituitary tumor, or diuretics and low salt intake is recommended to encourage the kidneys to conserve water. If diabetes insipidus is suspected, try the remedies below. If there is no improvement within 1 week, see your doctor. If the symptoms are severe, see your doctor within 12 hours. To be taken, specific remedies, to be taken 4 times daily for up to 7 days. Symptoms follow head injury. Use Arnica 30C. Flow of urine is consistent both day and night. Use Squilla 30C. Flow of urine is greater at night. Use phosphoric acid 30C. Urination more copious at night, accompanied by an increase in sexual excitement. Urine smells like herbs. Use Murex 30C. Person extremely thin and debilitated. Use Uranium Knit 30C. Diabetes mellitus occurs when the pancreas secretes insufficient insulin or none at all. Without insulin, cells cannot absorb energy, giving glucose from the blood, nor can the liver absorb and store it. Excess glucose is excreted in the urine, which has to have a higher water content than normal to carry it, so urination is frequent and passed in large amounts, and the person is continually thirsty. Also, because tissues are starved of glucose, the person feels tired and apathetic, and may lose a lot of weight as the body breaks down in fat and muscle for energy. Other likely symptoms are lowered resistance to infection, especially urinary tract infections, because germs flourish in a sugary environment. Also cramps, tingling in the hands and feet, blurred vision, and possible erectile difficulties, and cessation of periods. Longer-term complications include diabetic retinopathy, which is the scarring of the retina, damage to the peripheral nerves, and chronic kidney failure. As a group, diabetics are also more vulnerable to atherosclerosis. In some cases, diabetes mellitus is a consequence of another disorder, usually hormonal. The speed at which the symptoms onset depends on the age at which the disease sets in and the degree of the malfunction of the pancreas. Insulin-dependent diabetes, also referred to as juvenile diabetes or type 1 diabetes, is the form of diabetes mellitus, most frequent in young people. It onsets in a matter of weeks or months, and occurs because the pancreas produces little or no insulin. Incompetence of the pancreas may be congenital or the result of an autoimmune reaction triggered by a viral infection, such as the mumps or rubella. The high incidence of insulin-dependent diabetes in Western countries may have something to do with high consumptions of carbohydrates and dairy products. The orthodox treatment consists of daily insulin injections, because insulin taken by mouth would be destroyed in the stomach, and as a strict timetable of meals and snacks, so that the glucose levels in the blood remain more or less constant. Insulin non-dependent diabetes, also known as maturity onset diabetes or type 2 diabetes, is predominantly a disease of middle and old age and is most common among people aged 50 to 70 and onsets very gradually. The majority of sufferers are overweight, and about a third have a family history of maturity-onset diabetes. With type 2 diabetes, the pancreas does produce insulin, but not in sufficient amounts to fuel the excessive body bulk, and in any case tends to become less efficient with age. This type of diabetes mellitus is usually treated by the strict control of the diet, substituting small amounts of unrefined carbohydrates for intensely sugary foods such as sweets, chocolates, biscuits, cakes, jams, and soft drinks, as well as eating plenty of uncooked vegetables and fruit, and fiber-rich cereals, which usually reduce the weight to a level where the pancreas can cope with it. But if the blood still has too much glucose in it, the person may be put on hypoglycemic or glucose-lowering drugs. All diabetics are advised to carry some sort of identification, giving instructions on what to do in emergencies. If a diabetic develops symptoms of hypoglycemia, which is a sudden loss of energy, hunger, swelling, dizziness, weakness, unsteadiness, headache, irritability, slurred speech, or pins and needles, give sugar or glucose by mouth immediately to prevent them from becoming unconscious. But if this happens despite giving sugar, call 911 because they may be going into a hyperglycemic coma. Constitutional homeopathic treatment is recommended in addition to orthodox treatment and is compatible with it. The remedies that follow may help while constitutional treatment is being sought. Specific remedies to be taken 4 times daily for up to 14 days. Symptoms brought on by nervous exhaustion, grief, working too hard. Use phosphoric acid 6C. Symptoms include digestive upsets, emaciation, weakness, and bedwetting. Use uranium knit 6C. Symptoms include swollen ankles. Use Argentum knit 6C. Skin irritation, restlessness, depression. Use codinum, that's Codeinum 6C. Symptoms accompanied by gout. Use Natrum sulph 6C. Symptoms include cold, sweaty, smelly feet, and loss of stamina. Use Silicea 6C. Self-care. The treatment of both insulin-dependent and insulin-non-dependent diabetes is largely self-administered, requiring considerable discipline. The diabetic will be expected to test their blood and urine at regular intervals, and they will need to eat their meals and give themselves insulin injections at set times each day, or strictly follow the caloric intake rules given to them by their doctor. Extra vitamin C, B6, B12, chromium, zinc, magnesium, and potassium are recommended. Also vitamin E if there are eye complications. The intake of salt and alcohol should be restricted. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.